I would like to talk about America's healthcare system and how a person's economics and zip code almost guarantee subpar healthcare.
Well, you're asking for a lot on a Sunday. America has the potential of having the greatest healthcare system in the world, but because of corporate greed and pharmaceutical manipulation, it has the worst. That the masses of people have to suffer just to get basic health care. And that most of the people in the healthcare industry, even those who mean well, end up, if they're going to survive in that industry, they got to become pill-pushing manipulators who don't even care about the health of the person. So you walk into a doctor's office and you get an examination, the routine. You know, you check my blood, you do an EKG, you check my weight, etc. And then you do the basic exam. And depending on what I'm ill, you're passing me a bottle of something, the latest pharmaceutical junk that's been put in the marketplace. Because every doctor get a kickback based on the amount of prescriptions they're writing for certain medications. I mean, like, what's that? You know? Most doctors have so many patients, they really can't deal with the health of the patient. It becomes almost like a treadmill, you know?
I always talk to people like, right now for my primary physician, I'm lucky if I'm in front of them for about 7 minutes, 5 to 7 minutes, no more than that.
Right. And so I'm lucky because I have a primary who I've known for 25, almost 30 years, and she's a friend. And so if she sees something wrong, she'll call me at home. But everybody isn't that lucky. Or if I go to see Cynthia, we may fight over what I'm doing or not doing or something, but she's not going to let me leave that office until she makes sure she's done checked for everything, you know. But everybody don't get a Dr. Cynthia Marcus, you know. And so, but my wife is a physician, and she just retired, and she worked in adolescent medicine. And I saw her struggling through the years to fight as an advocate. Adolescent medicine is the children from, I think, 13 to 21. And so she had to become their advocate. She had to fight the rest of the system that she's working in for these children. And that went on until the day she was leaving. Matter of fact, people still call in the house, you know. Because the system is designed to make money. A hospital must make money. To make money, you must have patience. To have patience, you must let people be sick, okay? I'm gonna put, you don't make them sick, you just let them be sick. You don't heal them, you maintain them. And the medical system in America is not a healing system, it's a maintenance system that's driven, the maintenance is driven by the pharmaceuticals who come up, they'll give you one drug, and then they'll give you a drug to handle the effects of that drug, you know? And the doctors, you're making money. If you don't push this stuff, then you can be in trouble in being able to find work in the industry. And I used to go, I remember, to my doctor's office, and there was always a line of pharmaceutical salespersons sitting there with their little briefcase and stuff. And I go, like, what's that really all about? And that's a kickback system. You push our drugs and you get a certain percentage on what you are able to write prescriptions for.
Regarding the effectiveness of the drugs that are side effects of the drugs on your patient.
Who cares? They give you the list of it. Almost all of it will kill you just for taking it, you know? But at the end of the day, we don't have a healing system. We have a patient maintenance system that you must have patience to drive the system. You walk into an emergency room and say, I've got a splint in my finger. You walk back out, that's $1,000 bill plus.
I know you currently have some experiences with the healthcare industry. Can you share your personal experiences with the healthcare industry?
Yeah, I talk to people about it. Like I said, I've been very lucky. I've had some good people. I've had some bad people. But because I've been involved with the system, I have an enlarged prostate. I just got through with a procedure called embolism catheterization, very dangerous procedure, where they go through my wrist with a catheter, and they go all the way down to my groin with this wire thing. And they catheterize some of the blood vessels to cut off the oxygen flow to the prostate to then force it to shrink. During the process of the 35 years or so I've struggled with this, I've like bled monthly, 2,000-3,000 a month. I may have a bleeding episode. I may have blood clots in my bladder for months at a time. I'd have to go to the hospital occasionally to be catheterized so that I could drain my bladder and try to wash some of the blood out. Sometimes I've been hospitalized with big jugs of water just washing me out through the years. I've given lectures. People have known I'm wearing a bag strapped to my leg, but I either have an African robe or baggy pants. So nobody knows that I'm going through this. Because the industry, men were dying very young, usually in their late 60s on average. So there was no money to be made off of fixing the prostate.
That's a cold statement, man.
Huh?
That's a cold statement.
It's a real statement. And so after 35 years of back and forth, I said, that's real. I went to like about 5 or 6 different urologists. All of them are fairly good people, mean well. And most of them are honest enough to tell me what they weren't able to do. They just didn't have the technology and the knowledge. In the last 10 years, though, the technology has exploded.
So you're telling me men, you say you've been doing this for over 3 decades?
Mm-hmm. I know everybody thought this sort of handsome, bravado brother out there speaking and stuff. And they go like, yeah, but sisters, I couldn't function very well because this thing had been on me in ways you can't even imagine. Imagine just going to the bathroom and I think I'm urinating and all I get is red. And I'm standing there going, oh God, not again, Prostate is supposed to be as big as a walnut. Mine was bigger than a grapefruit. And it just crushed my bladder and that causing capillary breakage, and that's what caused the bleeding. And then that could block up your urethra, and then you couldn't urinate, and that's a terrible situation because that backs up to your kidney, and that could poison you and kill you. And so I'd have to go to the hospital and have catheters placed in me to drain me out, to get the blood clots out. Sometimes it'd be so bad I had to do like 3-4 catheters in 3 or 4 days because it got clogged up with blood clot. So yeah, I went through that for 35 years and managed myself. I had some good urologists who helped me along the way. And they had a couple of medicine, but neither worked very well. They've got a couple of new drugs now, and they seem to work much better. But they couldn't do me any good because mine was so big, right? And so the procedure I'm just coming from under 3 weeks ago seemed to, after almost 40 years, work, right? It has shrunk. I could feel it shrinking.
Is there less pain now?
Yeah, hardly no pain. The only pain I have now is in my hand where they went in through my artery. Because the artery, I didn't realize, had both muscles and nerves in there, unlike the vein. The vein is just like a tube, but the artery is different. And I'd been talking for years to people where I could about the prostate and my situation. But I plan to do a lot more because I realized when I was going through this, I'm calling all of my friends. And about 8 out of 10 had had some kind of surgical procedure for the prostate cancer or enlarged prostate cancer or an enlarged prostate. And none of them was talking about it. And so I told them I'm going to bring them all on a show. They got to come on somebody's platform with me. And we're going to talk to young people about what are the signs, what do you need to look for, what kind of literature you need to read to get a good sense and understanding how your body works, what kind of diet you need to lean towards, and those kinds of things.
Can you just tell our viewers briefly the things they should be looking out for the prostate?
Right. The first thing is when you go to urinate and you have to wait. and then the stream is poor. Instead of having a nice flush, you're getting almost a dribble, you know. And then when you finish, you're not fully emptying. Your bladder hasn't been fully emptied. And then within an hour or so, you got to go back to the bathroom again. And so that increases in all kinds of ways, especially in the evening when you go to sleep. You end up having to wake up 2-3 times a night to go to the bathroom. And each time, again, you're not emptying out the bladder enough. And then you have other stuff. You get constipated, you know, because all of all of those instruments are in the same place. Your urethra, your what do you call it? Your rectum, your bladder. A man don't have the same space that a woman have in this area. So we have a small space, and so everything is kind of touching on each other. So you get constipated. You find I can't go to the bathroom. I want to pee really bad, but I can't go because I'm constipated. And then you're just getting a little bit out at a time. And then you got to go back in 15 minutes. When those things start happening, you need to go to your doctor and really, you know, start with a sonogram or ultrasound, see whether it's an enlargement. They have another thing. You have ask for a PSA test. Your PSA should be around between 1 and 3. That's called PSA is prostate serum antigen, and they measure that. That's not 100%, but that's the best deal in town. And if that starts rising, you need to question what's going on with your prostate, because it could be cancerous or it could be enlargement. But it usually hits you in your 40s, but we don't pay attention to it until our 60s. Same thing happens. You may want to get an erection. You may get a good erection, but you find that you will ejaculate very quickly, and you don't even get to enjoy the sex process. That's another big signal that you need to go and check your prostate, because it sits right under the bladder and it surrounds the penis. And so once that begins to swell, it puts pressure on everything in that sector, your rectum, your urethra, your bladder, and everything affects one another. So constipation could throw you into trouble, drinking too much. I used to like to drink beer. I don't do it anymore. You know, beer, you do like 2-3 bottles and you realize, oh, I gotta go to the bathroom. And then nothing comes out. Then you're leaning on the wall, you're dancing around the toilet stool, you're doing all kinds of things trying to get that water out. Any of those kinds of things begin to, and it develops slowly. When you see the signs of any of them, go to your doctor. So I want to have my prostate checked. You know, ultrasound is one of the best ways to see what it is in terms of size. If you have any other kinds of concern, then biopsy, you know, if your PSA gets too high. I mean, my PSA was up to like 60, 70. You're supposed to be going.
1 to 3?
Huh?
What you supposed to?
It should be 1 and 3.
And
mine is up to 60, yeah. So that means you're going, but that's because mine is so big. But the worst thing is the backup. When you get the backup in your bladder, that can back up into your kidneys, and the bacteria could cause trauma and cause you to lose the kidney or end up being on dialysis because you poisoned your kidney with the waste backup from the bladder because you haven't been able to empty out fully as you're going to the bathroom. And all of those things. The bleeding comes. I had a lot of bleeding. Mine was so big, it pressed up against the bladder and it broke capillaries in the bladder, and that blood bled into the urine. So you go to the bathroom and you get a bowl full of red and you go like, oh my God, I'm dying. And it wasn't all blood, but the urine had been turned to red. In some cases, you get a lot of blood, but blood is heavier than urine, so it sinks down and becomes a very, very horrible, what do you call it, blood clot. And you go to the bathroom one day and blood clot as big as your fingers squeezing out of you. And then, so all of those things, if you don't have help, you're going to go through. I didn't have help. Even I was going to doctors, they didn't know what to do. I mean, they were more frustrated than me until recent years, where they began to come up with new treatments. And as men began to live now older into their 75s, 80s, it's profitable for the industry to invest in cures and treatments for the prostate. Before, a man wasn't living long enough for them to make enough money off of the prostate. Let me just be frank.